Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to the Feel Better, Feel Great podcast, episode 118, Male Executive Stress and Andropause. I am Dr. Andrea McSwain. Before we delve into today's podcast, I want to remind you that I am a medical physician, but this information being shared is purely educational. It is not a substitute for personalized medical advice, diagnosis, or treatment. Please consult with your healthcare provider for tailored information specific to your needs. Now let's embark on this health journey together. So let me paint a picture. It often has come into our practice where, man comes in, doesn't know what's going on. He loves his family. He works hard for them. He's sitting in the chair. He's basically slumped over and he's like, I just don't know. I can't get any pickup. I don't have any desire to do anything. I'm basically dragging. I wake up in the morning hurting. I go to work. I try to concentrate during meetings with a lot of difficulty. I make it through the day, get home, try to take care of my kids, my family, and drag all through that. And then just can't wait to get to bed to go to sleep. Over the weekends, the amount of activities is really dwindled to just what needs to happen. And a lot of times the fun is really taken out. So not so much getting things done because they're fun or enjoyable activities, but they seem more obligatory. And we just can't figure out what's going on. And so the very nature of wanting to solve problems has really led to a lot of confusion as to what to do. And men like to fix problems. That's what I've come to discover. So when they can't fix this problem, which should seem very easy, but in fact, medicine is both a science and an art. Oftentimes, when people are trained in a field or in a profession, they learn a lot of information that is helpful, is wonderful, but then it's really important too to see how the reliance on other expertise can really help them get better. Okay, so we're going to think about medicine as both a science and an art. It is important when you're looking up things on Google it's important to realize that, yes, some of the information is there, but it's often fragmented, incomplete, and without context. Okay, so if you're tired, you're a male executive, you're starting to notice a decline in not only how you feel, but also just everyday life. You don't have a pickup anymore, and testosterone isn't really helping you, your male hormone, then we need to figure out how to move forward. So why do I know anything about this topic? What does a gynecologist who practices holistic medicine know about this subject? And why would I care? Well, I do care very much. First, as a gynae, most of my patients had male partners. And so I really wanted to help my patients have competent partners. And so I learned about prostate health. I learned about a lot of male health so that I could better understand how my gyne patients could then have healthy relationships intimately with their partners. Second, I now care for many patients who are male executives and who express serious fatigue. Sometimes when I work with male executives, I recognize that their problems have been unappreciative, and in many respects, they've actually been marginalized. They have gone to many doctors and been told to just kind of get over it, that their job is very stressful, and that's the reason why they're tired, run down, and not really enjoying their lives. So maybe they should take a vacation. Well, I definitely think taking a vacation is a great idea, but then you have to go back to work, and if you work in any kind of high-stress executive position, sometimes coming back from vacation is actually worse than just working. So it's not always the best suggestion for someone to go on vacation because they come back to even more stress and obligations that were unmet while they were away. And then it mounts, right? So that's a very stressful situation, kind of stuck between a rock and a hard place where you need to relax, but then that just means when you take time off, you have to make up for the time that you missed. And I can appreciate that. Definitely an executive stress position has very demanding roles, long hours, right? Requires travel, and there's constant pressure that impedes our physical, mental, and emotional health. Not to mention that there's a lot of times too where we're just expected to get the job done when people have high stress jobs. And that can be very daunting. The other thing that can happen is this can definitely weigh on your health and well-being, but there's another concept in medicine that is often not discussed when men come expressing some decline in their vitality. This is a term called andropause. It's a very important term. It gives context. It is not a diagnose and adios situation. I very much want to explain it so that you can understand maybe if this fits you and what you can then understand and how to take care of it. So andropause sounds a lot like menopause. And menopause is when females start to have hormonal changes that then affect their reproductive capacity. Menopause is a much more obvious time for females, and it contrasts greatly with andropause because andropause is much more insidious. It has a much slower decline usually. Sometimes it can have quite a sharp decline, and that can be extremely disconcerting for men. So when you think about andropause, it definitely is talking about a significance in male aging. So now the body is kind of shutting down some of the areas that are not necessarily vital for survival. When the body is in survival mode, then we're looking at some of the things that are not necessary being reduced, potentially by the body. It doesn't have to be that way or stay that way. It's very important. So again, these hormonal changes can have some significant health impacts for everyone who goes through the pause or change in life. Men don't even get to hear the word andropause. So this might very well be the very first time that you've heard it. And if that's the case, then just take a moment to kind of absorb what that means and see if it's relevant to you. Is there muscle integrity decline? Is there maybe some height compression? Can you not lift as much? Are there changes in physical intimacy and capacity there? Is the abdomen growing a little bit? Is it more difficult to digest food? Is it causing some sleep disturbances? Are you possibly not regulating your temperature as well? These can all be signs and symptoms of changes, and we want to address them. But first, we have to acknowledge them. Because andropause is much like menopause in that it's a big hormonal shift, and then there's a lot of signs and symptoms and sequelae because of it, there's usually two approaches that I've found men who have been told. One, get over it. My least favorite thing to hear. Or what I find is prevalent over the last 20, 30 years from an integrative approach is hormone replacement therapy. So if someone comes in to a practice, an integrative medicine practice, and it's a male talking about being tired, run down, kind of brain's not working that great, problem solving is a little bit harder, muscles aren't really firing as well. If that's you and the first thing you hear from someone is, let's get you tested for your testosterone so we can get you on hormone replacement therapy and start taking testosterone shots or testosterone pellets, then you need to recognize you might be falling into a trap. I am significantly against the idea of having someone come into the office and immediately dose them with hormones. I'm going to take a little bit of a sidebar comment to give you some background on that. When I first entered my practice, people said, well, you can be the hormone doctor. And I thought, that is not me. I think hormones are cherry on the top. Hormones are wonderful. They're important. It's always the lowest dose for the shortest amount of time. That being said, I'm a big advocate for people using hormone therapy for their entire lives. But that is not the place to start. If you don't know what's going on metabolically, if you don't know what's going on for risk for infection, if you don't understand some other really important implications that might be the reason that the body is tired, sluggish, not functioning anywhere near optimally, then those are the first places to start. So when I was told at the beginning, like, be the hormone doctor, it'll be great, everyone will come to you. And anytime I put myself out there that way, people who came to me and I first started prescribing hormones as the first line approach, it did not work, and it will not work because it is the cherry on the top. So going to someone who's going to just give you hormones, you are probably not going to get better for the long haul. Remember, thinking healthy at 100. If hormones are part of your protocol, after metabolics, after review of concern for infection, then I think it's wonderful. So that's my sidebar, but I think it's really important. So please do not fall into that trap, because it's the carrot that's dangling right in front of you. Like, oh, I'm feeling kind of less manly, if you will. So what am I going to do? Add testosterone, right? Add T, roid up. Just an awful, awful pitfall. Having said that, what I want you to understand are some key biomarkers, and let's explore some underlying causes. First, what's going on? Okay, we have to know that metabolically. How is your metabolism working or overworking that might be causing some areas of deficiency? Important biomarkers to consider are your lipids, which are really important to make hormones. You need good, healthy fats. Second, we need to be looking at micronutrients of substance, vitamin D, B12, omega-3s. Why? Because they're all very important for how your body functions. And if they're deficient, you're going to be symptomatic. Then we want to look at your thyroid. That's a very important hormone. The other thing is exploring the adrenals. Think about adrenaline. The adrenals are very important to get you going, up and going. And if you have adrenal fatigue, you're going to be exhausted, because the adrenals are about energy. They're about blood pressure regulation. They're about libido. And so if there are problems in those areas, it is really critical to look at the adrenals. They all have significant biomarkers that are very easy to assess in blood work. Also, the adrenals regulate the reproductive axis. So again, if there's concern about not feeling that manly feeling, it's often because the adrenals have now been overtaxed, and we need to get those reset. Okay. It could definitely be something other than low testosterone, as I mentioned. There are some deficiencies in vitamins that are really important. And I want to tell you, if you don't have enough D, you won't make T. Meaning vitamin D is a significant prohormone that helps the body produce testosterone. Again, that's in general terms, but it's worked very well. I had a patient who came into my practice who had low testosterone, but also had low vitamin D, and also had some dysregulation with their lipids. Did I start with testosterone? No. They were also complaining, I should mention this, of some low virility. When I saw them, I said, let's first start with your D. Let's get some omega-9s on board, which is olive oil, which I call testosterone oil. But having 1 or 2 tablespoons of olive oil in the day to help build up that testosterone really helped. The omegas helped. And then we looked at vitamin D, all those bolstered. And a lot of the symptoms that were present readily reduced. And so I encourage you to think about how we can actually be more root cause in helping you feel stronger, more confident, have better brain function. And very important, significant concern here as well for an underlying cause could be infection. If you're a hunter or go outdoors, or you're on the football field a lot, you are at risk for Lyme exposure. If you work in an industrial environment, you may be exposed to toxic metals causing overwhelm, and those are significant reasons for fatigue and ultimately for hormone decline, as we see with Andropause. So I realize these are some different topics. This is a different, I wouldn't say it's a different approach. I would say this is a diverse approach. It's also very forgiving, and it looks at how to reverse the problems that you have in a long-term solution. Is it a quick fix? It's fairly quick. I mean, a lot of times looking at the biomarkers and blood work to see what nutrients are missing and how the adrenals are doing, the lipids, the thyroid, and then saying, okay, let me get started on some supplementation, some infusions, adding some other infusions like NAD, which is going to go and support the muscles and the cellular function. These are also really important things to do. Sauna is going to improve blood supply. It's going to get you a good sweat. You can always get a good sweat in other ways, but a good sweat is very important, and get that blood pumping and get that heart going. Now, even if you're very tired, it's very likely you can sit in a sauna, particularly an infrared sauna, checking that there's no electromagnetic frequency that's elevated. So you want a really safe infrared dry sauna. Sweat it out while you're sitting there, relax for a few minutes, or even check your phone, because if it's got low EMF in the sauna, it's actually going to be a good time to just get a little bit of work done and actually have it help your body. Then what else can you do? Well, you can use nutrients topically to support the skin so that you can have some better absorption there. I know that sounds very simplistic, but it actually works great for men. And you look better and you feel better. Then what are some other things? Well, sometimes when you have maybe some teenage children, or you're out with a lot of work meetings, or you're traveling, you don't get to necessarily dictate every part of your diet. And I can understand that. If you can eat something nutritious, even with something that's not nutritious, you're much better off. You can add broccoli. If you can have some good quality dried fruit in the car, if you can have a protein shake, just the powder, and you can get it into a protein shaker, you might be able to count that as a meal. If you can add liquid to your meals, these are very good ways to improve your digestion. And that's very important, because when we're looking at how your body is working, food is medicine, and food can also be very detrimental, as you know. And so when you're eating and you have these little hacks, what can happen is you can kind of combat the difficulty of being in a high stress situation with your gut not getting the blood supply that it needs. So let me phrase that a little bit differently. When you are in a high stress situation, your body will provide less blood supply to your gut. So if you're at one of those executive high power lunches, dinners, whatever, and you're pitching something, and it really matters, you're not going to have a lot of blood supply to your gut. Your body's going to be in sympathetics. It's going to be using up your adrenaline, and then you're expected to eat something probably very rich, like a steak or something of that nature, lots of butter, etc. And so, first of all, if you can, make sure that you're getting also something nutritious then. So mixed vegetables, broccoli, asparagus, whatever you can get on the side that's nice and green and healthy. This will help you. The other thing is to recognize that when you're traveling a lot, your body doesn't necessarily get the sleep quality that it needs, or the amount of sleep you need. And that is very important as well for digestion. So in those kind of situations, you'll also benefit from digestive enzymes, because digestive enzymes are going to support your ability to break down the food and get it absorbed, even if you're in a higher stress situation. So there are some tips there, and also understanding how the gut is impacted by executive stress in those very specific executive stress circumstances. Another practical tip for male executives is to think about how they are moving. So if you are bench pressing or lifting a lot of weight, your body might already be a little bit more in a contracted state due to lots of sitting and long hours. So if you're at the gym and you are using weights, you're adding a compressive force into those muscles and extra contraction is going on. You want to think about the extension or the expansion part of the movement of that exercise. So if you're bench pressing and you're thinking about the down part, you actually want to think more about the pushing away part to get the length. If you're doing squats, you can go down, but definitely put a lot of energy into thinking about how to stand erect to lengthen those quads and lengthen those glutes. So a lot of times there's an emphasis, particularly with lifting, that is more about the contraction. And I want you to think more about the expansion and getting those muscles to elongate so that they can then handle some of the times where you're in a contracted state with travel or sitting for a long time or listening to meetings, etc. And that is a very important part of balance, thoughtfulness that will then increase your muscle tone, which will then build testosterone. So that's very important. And then when you are waking in the morning, it's also a very good idea to get some good stretching in, which could just mean 20 seconds of laying on your stomach and doing something like tummy time, which I have an Instagram video on. But laying on your stomach and kind of going into a Superman pose will reactivate the abdominal rectus muscles and get them to get long. And when they get long, that is very helpful for maintaining an expansive quality of the core muscles. It will also open up your digestion. It'll allow you to breathe easier. It'll allow the liver to pump better. All those things are really critical, practical tips for male executives. And then once we start looking at some things to help you recover, we start looking at biohacking strategies. A simple biohacking strategy to build the mitochondria is to have a warm shower and then turn on to a cool shower, not cold, okay? I understand Wim Hof is very superhuman, but this is really directed for you if you're dealing with significant fatigue. If you go to really cold, the chances of you actually getting colder and sicker and exhausting yourself at a metabolic level or even a mitochondrial level is very possible. So this is my tip to actually get the benefits of learning how to thermoregulate in your body, which is start with your regular temperature shower, warm, and then turn it down a few degrees so you can feel that cooler temperature on your body, in your armpits, your abdomen, but never do it on your back, and keep that for up to 60 seconds and return to your normal temperature before getting out of the shower. As you progress through this, you'll lower the temperature down even more. Again, keep it on the front of your body and not the back. And then you might end the shower with the cool temperature, and that might be even more invigorating. Okay, when you thermoregulate, that's going to be very helpful. Another way to support thermoregulation, and especially in the beginning, is thyroid support. When we look at thyroid support, this goes back to a key biomarker, but thyroid will help you pump more fluid out of your body, make your muscles stronger, uncouple the mitochondria so that the energy is released better. It will give you a lot of power. It will also support your heart. And that is another key consideration here, because cardiovascular disease in males with executive stress is extremely high. And it is very disconcerting to see when men are coming in feeling fatigued, their adrenals aren't that great, their gut's having problems, they're not sleeping well, their muscles aren't strong anymore, they're struggling for an intimate relationship with their partner, and they're being ignored. Because in this country, we are plagued with men in their early 50s having sudden cardiac death. And it has been one of my personal ambitions in my practice to reduce the incidence of sudden cardiac death in male executives. Now, how do I know if I'm doing it? I don't exactly know. How would I? I can't exactly compare that. But if my patients are getting healthier and stronger and their hearts are not getting taxed and they're not having cardiac and cardiovascular conditions, then I know that prevention is the old adage, right? An ounce of prevention is worth a pound of cure. So while I might never know exactly the impact that these conversations have on preventing sudden cardiac death, it is one of my personal ambitions, because when families are destroyed from SCD, I feel like the medical community has failed that family. and in many ways failed that community. When men work really hard to take care of their families and their communities, and then they're ignored, so much so that their organs decline, their hormones decline, and they start going into a huge disruption for sudden cardiac death. I think that is when we really need to look at how we have failing, not just an individual, but a society. When I was attending church, there was a very nice, very jovial pastor. He had come to the church with love and kindness. He was joyful, sweet. His voice was strong and robust. And I didn't attend church for a while. I think I had moved and I came back, and only to find out that this man, he had I hardly heard him talk really, but when he gave a few pastors, because he was coming in, he might have even been interim, he said something remarkable. He said, when you drive past a place, you see it. When you ride your bike past a place, you see it even more. But if you walk, you can take the time to see all the little things that are going on in that little tiny world, that little tiny environment. And I was very touched when he said that. So to come back to the church and to find out that he had died at 52 years old from sudden cardiac death, it was shocking. Here was a man who was facing a community with love. He had a loving family and children, and now he's gone, and everyone's impacted by his absence. And that is a world that is missing out on his potential. So I encourage you to think about this topic, share it with others. Let's take people's concerns seriously, because we really need to appreciate if someone's having a condition that is reversible, so that we can get everyone healthy at 100. Thank you very much.